Hey everyone, good morning and thanks a lot for taking out the time for joining the webinar. Perfect. Good morning everyone. My name is Anmol and I'm the co-founder and CEO of Emitrr. I see a couple of familiar names, but just before we were running a practice session this morning, my team member told me I look very different. So I thought I'll let everyone know I'm the same person who's been running webinars, the YouTube videos that you see, just that the look has changed a bit. Thanks a lot for doing this morning. Today's topic that we're going to cover is that how successful practices are using AI to drive 20 to 30% more revenue after hours. The agenda for today's webinar is really to understand how AI can actually drive 20 to 30% more revenue after hours. And if you start to use it during office hours, then of course the value is completely different. And we're going to share 5 different examples from 5 actual case studies that we've seen across our customer base. And these are practices that we've implemented for these customers. During the webinar, if you have any questions, feel free to drop them in the Q&A session. So we'll just need about 20 to 25 minutes to cover through the slides and what are our learnings. So let's jump right in. Today, what we're going to cover is, what are the different areas which lead to revenue leaks, the agenda for today, and 5 ways you can use AI after hours, right? And we'll also show you the case study, which we are talking about, where we've seen AI generate a lot of business. The 2 ways to look at 20 to 30% revenue increase is not just from a revenue standpoint, but also from time saved on full-time resources in the team, right? So either you save money by not spending it on more full-time resources, or you increase revenue by adding more top of the funnel. So those are the 2 ways we will look at today's topic. Before we do that, a quick context or background setting where practices lose revenue every day. Our learning over the last 7 years have taught us that at least 20 to 25% of the incoming calls are missed every day. Now, reasons could be multiple, either because patients are calling after hours, on weekends, or while your front desk team is busy on another call. And unfortunately, 23% of the appointments end up in no-shows. The problem that we are going after is we're trying to see that can we make sure that every provider in every office can have 100% of their appointment slots always booked. Reminders could be one way, but then there are also a lot of other automations. Almost every office that we speak to tells us that 60 to 80% of the calls after hours go to voicemails or to an answering service, which just basically collects the message. Whether it goes to a voicemail or to an answering service, it's just the same thing, because an answering service is just guided voicemail. They're not really booking appointments for you or collecting revenue for you. And why that doesn't work and how that has changed in the world of AI is what we're going to cover through this webinar. And on average, we've seen average cost of each missed appointment is anywhere between $150 to $300. Now you may say that, hey, we are a physical therapy practice, so our average appointments are at about $80 to $100. So this is not completely true. But the way we look at it is slightly different. You lose time, you lose $80 to $100 today. You rebook that patient who missed the appointment in another slot. That's another $80 to $100 because you could have seen someone else then. And you also lose staff time in trying to reschedule them, right? So that's the actual cost of a missed appointment. It's not just isolated to that appointment. And we've also learned, this is from our own customer base of 1,000 plus customers, 60 to 80% of patients don't leave a message if they call you after hours, or even during hours if you're not able to reach them. Those are the problem areas which cause loss of revenue for practices. About me, as I said, we started Emitrr back in 2018. We are an AI-driven patient communication platform. And in total, since 2018, we've worked with 3,000 plus healthcare practices. So whatever I share today is purely from learnings of working with 3,000 plus healthcare practices. The one thing that I want to let everybody know, post AI, our approach to problems in healthcare have completely changed. How we see healthcare as a business has completely changed. Let me give you a quick sort of overview of that, and then we'll talk about the specific problems and how to solve those problems. We tell everybody that think of your healthcare practice like a highway. And what happens on a highway? At the toll gate, there's always a gridlock. And why is there a gridlock? Because hundreds of vehicles, cars, trucks, and everyone else is getting stuck at the toll trying to get access to the highway, right? So the tolls are always gridlocked, which is what, essentially causes the gridlock. Now, if you look at a healthcare practice, the highway is basically the providers, and that's where basically all the patients need to go. But the front desk is actually the toll, right? Because everybody has to pass through the front desk or the office manager. And you cannot keep staffing up the front desk, right? Because you will have different, just the way I said, you have large vehicles, small vehicles, you have different problems. Similarly, you have voicemails, you have patients in practice who do not fill their forms, you have patients who come unprepared for their appointment, you have patients who call after hours. Different problems will cause different gridlocks in the practice, and those are the problems that we're trying to solve. We're looking at a front desk holistically and saying that, hey, what are the reasons why a front desk's time gets lost, and can we save and bring that time back for them? So everything that you see in today's webinar will align to that very goal. So let's jump right in. I already covered what are the potential areas which cause revenue loss, but I'll also cover what you'll learn today. One, how do you capture missed patient demand, even after hours, without needing additional staff, without needing an answering service? And this is not just, a simple voicemail where the staff still needs to come back and look at it. We'll show you exactly how we will help you prioritize voicemails and make them more actionable. Two, how do you automate repetitive workflows like refills, scheduling? These are repetitive. Patients come in and request refills again and again, and the process remains the same. How do you instantly respond to every patient query without adding additional staff? How do you reduce no-shows? And how do you eliminate manual triage of calls, voicemails, and messages? This is extremely important because we've seen a lot of practices in Area 5 actually do manual triage or have a switchboard number where you have to press 1 for this, press 2 for this. We've been able to completely replace that with the help of AI. So problem number 1, right, which is calls coming in after hours. I'm sure we've all in the world of Uber, in the world of DoorDash, realized that speed is probably important. We all experience and expect that today ourselves. So when we expect to get an Uber in just 2 minutes or get our food delivered in 30 minutes with the help of DoorDash or Uber Eats, why should our patients, or basically potential patients or actual patients, have to wait after hours, right? When we as humans, even on a Saturday and Sunday, want the Uber to work, and even on a Saturday and Sunday want that we get our food delivered in 30 minutes or 15 minutes from the nearest restaurant or our favorite restaurant, that's exactly the experience we should deliver to our patients, because healthcare is even more important than eating at our favorite restaurant or getting a ride through Uber. So speed becomes equally important, rather more important in healthcare. And the problem is that patients after hours have to almost always leave a voicemail or go over to an answering service who's not trained to handle their queries. So these queries get mismanaged. So that's what we've seen across all the practices that we work with before we started working with, that patients expect a response almost instantly, but they don't get that, especially after hours. And what do winning practices do, right? So winning practices basically have an AI agent that automatically answers queries after hours. So it responds 24/7, it triages calls 24/7 even during office hours, and it answers FAQs without staff involvement. Let me give you a quick example of what that means. Let's say you get a call at 8 p.m. tonight. In all likelihood, either that will land in a voicemail or that will go to an answering service, or the patient will just be told, hey, if this is a medical emergency, hang up and dial 911 because this is after hours. In the world of AI, you don't need that at all. What AI can do is, if it's after hours, it can pick up that call and book a patient an appointment, or if it's for prescription refills, also refill that patient right into your EHR. If it is during office hours, the AI can actually understand what is the call for and triage it to the right team. Should this go to the nursing team, to the billing team, to the front desk team, right? That's the kind of result that we've seen with the practices that have used AI today. They don't have to at all worry about, because if you don't use AI, what you will have to do is when you come back tomorrow, you will have to listen to your voicemails one by one and understand which one is the most important one versus which one is maybe a spam, a marketing, or a sales call. But with AI, this is the result that you see. You see instant reply, triage, and the calls are being booked. Another area that I want to bring to your attention is, a lot of times we've seen practices receive level 1 calls, which is what I was talking about here, that you can answer FAQs as well, right? So a lot of times we've seen practices get calls from patients asking them, hey, when's my appointment? Now, front desk doesn't need to pick up that phone, look into the EHR, answer that question, and lose that time. What AI does instantly is if a patient calls, AI knows already it is patient, for example, Anmol, right? And if a patient asks, when's my appointment? AI has already collected that information and instantly answers that question that, hey, Anmol, your appointment is at 2 p.m. tomorrow with provider ABC. Now, whether that question was answered with AI or through a human, the outcome does not change. So that's what we've seen winning practices do. They've automated all of their level 1 calls and they've automated all of their repetitive calls, be it during hours or after office hours, leading to a much better patient experience and also leading to better revenue. The second one is, even after you have AI or you have an answering service, a lot of patients do still prefer leaving a voicemail, maybe because that voicemail is for the provider and they just want the provider to have access to that voicemail. But the problem is that if you get 100 voicemails after hours or even during office hours, how do you make it actionable? Let me ask you a very simple question. Almost everybody who's on this call, I'm sure that when you come back after hours, you look at all your voicemail messages or fax messages, and even if you have 10, 20, you go through them one by one, right? If you have a different method, feel free to leave that in the chat. I'd be curious to learn, but I'm sure that we get voicemails after hours. We come back at 8 a.m. in the morning. We look at the voicemails in the fashion that they're organized in our voicemail inbox. Listen to them one by one, reach back out to the patient. What has AI done? What does our system do with the help of AI? If you get voicemails from 6 p.m. today to 8 a.m. in the morning tomorrow, or even on weekends, our system will actually categorize those voicemails by letting you know that this voicemail was from patient A, this was an urgent query versus a non-urgent query. This was for an appointment versus this was for a prescription refill, and auto-assign it to the right teams. So you see, staff spends lesser time now because staff can see just the voicemails that are relevant to them, and they can filter between urgent versus non-urgent voicemails. So you can almost imagine when you come back tomorrow, you don't have to go through one by one all the voicemails. You can just see which ones are urgent versus which ones are non-urgent, which ones are important for you, and which ones are not relevant to you. But we've taken this a step ahead. What we've also done is, apart from smart triaging, which I spoke about, there's also an AI agent that we've added. In all likelihood, when you listen to voicemails, you're going to pick up the phone and reach out to the patient. What we've done is, when you receive a voicemail, we tag them into what these voicemails are all about, assign them to the right teams, and also have, by choice, you can choose to use this or not choose this, by choice, the AI agent can actually reach back out to the patient through SMS or through voice, because that's what you're going to do next. So we are trying to build an agent that will automate all of your work. And that's what winning practices are doing today. So that's the result that we see. As you can see here, what we'll do is, I'm looking to speak to someone at Emitrr team, we'll transcribe the voicemail, but the system will also reach back out to them through SMS and through calls, right? The third problem is repetitive queries after hours. A lot of times we've seen that 40 to 60% of the calls, even during office hours or after hours, are basically for repetitive queries. Hey, when's my appointment? What's your office location? What insurances do you have in network? Questions about services, prescription refills, or trying to book an appointment. We've seen these are the common queries that you get, like basically after or during office hours, which create a gridlock for the practice manager or for the front desk receptionist. Now, winning practices, what they do is they've employed an AI agent that picks up the call, collects all the information. A simple example, let's say for example, for prescription refills, an AI agent will pick up the phone call, collect all the information, validate that with the EHR, whether this prescription should be refilled or does this patient actually need an appointment, match that with the provider and send them to the provider for creating basically a signing order for the prescription refill approval or non-approval. Where we are saving time for the teams is front desk team members don't have to take that call anymore and collect any data and do not have to upload that into the EHR. All of that is being done with the help of AI. AI picks up the phone for all repetitive queries, collects information, uploads that into the EHR, be it for prescription refills or be it for appointments or be it for answering any queries, right? And this is how an AI agent handles a refill calls, right? So for example, if you get a prescription refill call, the AI agent will pick up and get details about their name, date of birth, pharmacy, dosage, and feed that into the EHR for something like this, right? Where it'll show all the notes and the provider or the office manager just has to approve it. So we're completely removing all the work for the front desk team so they can focus on something more important. And we're just sending it directly to the providers for approval. That's exactly what's happening for not just prescriptions, but also for appointments. So you can imagine how much time this saves you during office hours as well as after office hours. The fourth one, of course, is that you want to let patients book, which I think I already covered through these examples, but you want to let patients book even when you're closed, right? And this is the problem. Patients, if you see a lot of practices, they'll get reviews that, hey, they don't answer calls after hours, or I left a voicemail but never heard back. And winning practices let patients self-book, not just for calls coming after hours, but also in case a patient ends up being a no-show. What winning practices are doing is, if you have a no-show with us, they are automatically sending a message to the patient, or if a patient responds to your reminder saying that, hey, I need to reschedule, we've removed completely any human involvement from that loop. As soon as a no-show occurs, our system automatically sends out a text message saying that, hey, Anmol, looks like you missed your appointment. Do you want to rebook? Yes, I want to rebook. AI engages them and rebooks them with the same provider or with another provider based on their preference. So if you can see here, for example, I want to book an appointment, what date and time work, they can choose from that slot and the appointment gets booked. Data gets automatically synced into the EHR. Athena is just an example. We can do that with hundreds of EHRs. The last one, as I showed you, is that you want to stop morning backlogs from after hours queries, right? Where every morning that we speak to the front desk team, there's a joke internally that we have, right? That when you have to call a potential customer, don't call them in the morning, because in the morning they come back and they're always backlogged with voicemails, faxes, messages, missed calls, so on and so forth, right? That's exactly what we've completely eliminated. What we do is we auto-categorize all the incoming messages, incoming voicemails, and we smartly route them to the right team. If you're an Emitrr customer, you're probably using this as well. Not just voicemails, but also for SMS. What we do is we automatically triage SMSs based on rules. If you get 100 text messages or 50 text messages, whether it's during office hours or after office hours, you can write rules to automatically move them to the right team member, and also automatically send a text message to them, move them to a specific list, or take an action. So those are the kind of things that we've seen practices do to save time for themselves, right? One example that we have is Zynex Medical. They send out about 300,000 text messages every month and receive anywhere close to about, I think, 20 to 30,000 incoming messages. They had no structured way to handle this volume, right? What they did is they basically built AI agents in our system. Based on the incoming patient queries, they assign it to the right team member. They also automatically respond back to that patient and also move that data into the EHR, which saves them a lot of times, because otherwise they were doing all of this manually. Now imagine at that scale, they were having to manage 10,000 incoming messages manually. Today, that number is much below 2,000. They have a big team of about, I think, 100 plus agents. 100 plus agents can easily manage 2,000 messages. But even 10,000 messages for 100 plus agents was difficult. Today, they save about 32 plus hours every month. They use the AI-powered rule engine. They write rules and let agents take care of that. About 10 to 18% increase in prescription to sale, and 30 to 40 leads are recovered every month. What that means is, when they used to get leads coming in after hours, they would lose that, and now most of them are recovered. What could this mean for your practice, right? If today you're seeing missed calls, gaps after hours, or manual works, we could help you make sure that none of these calls are actually missed. They're all converted to voicemails. Voicemails become actionable. You get calls for scheduling appointment. We help you schedule those. And end-to-end workflows, be it patients who are potential patients or inquiries, we are able to help you convert them into patients by increasing that revenue. And we are able to help you improve your patient engagement, plus also retain them. So that's what solving for the patient journey, even before they become a patient, to when they are a patient, and to retaining them, is what will help you increase 20 to 30% of the overall revenue. So that's it for today. I'm happy to pause here and take any questions. If you want to reach out to me on anmol@emitrr.com. feel free to do that. Or of course, you always have our support number. But yeah, happy to pause here and take any questions from anybody. All right, I see Sheila, you have a question. How much does it cost? The cost depends on the product capabilities that you use. It's not like a standard cost, so I don't want to give that answer like a standard cost here, because then everybody will think that, hey, it's at $100 or $200, but they may need more capabilities. So happy to sort of have a conversation with you offline and share the cost with you based on your setup, how many AI calls you will need, so on and so forth. We can always make a note of that and reach out to you as well, Shira. Okay, I see there's another question. So Colin, you also want us to reach out, and same question about the cost. We'll be happy to reach out to you as well about the cost. Maybe we can reach out to everybody, and if you want to set up a demo or sort of get more information on the cost, then you can just head over to emitrr.com and also set up a demo, and our sales team will also be able to get you the cost. Plus, to be perfectly honest, I've covered everything at a surface level just to give you an understanding of what we can do. For your practice, we could integrate into the EHR, integrate into your workflows, and solve a lot of specific problems, maybe more than what I covered today. So I would definitely suggest heading over to emitrr.com, even if you don't want to see a demo, to set up a time with one of our folks on the customer-facing team, and they'll be happy to help you. What if there's no EHR? Kolim, you said, what if there's no EHR? Could you maybe tell us what do you use if you don't use an EHR to manage your patient data? That's a good question, by the way. So it's a good question because I think the practice uses pen and paper. We can help you digitize that. You can actually use our product to manage your patient data as well. We are not an EHR in full transparency, so I would always suggest use maybe a simple EHR that starts for a single provider, or you could even use maybe a simple Google Sheet to manage your patient data, and we can integrate with that, or you could use our system itself. So if you don't have an EHR, that's also no problem. You can put all of your data into our system, and within our system, you can write workflows to digitize and automate all of your patient engagement. We have Salesforce, but not all capabilities. We do integrate with Salesforce, so that's a good starting point. Yeah, we can probably tie into Salesforce and automate some of these things for you. All right, I do see a question from you, Douglas, about how does this work with hosted VoIP system. Happy to take that offline, but if you have a hosted VoIP system, we have the capability to integrate into any hosted VoIP systems. We integrate with all hosted VoIP systems, be it on cloud or be it hosted on your server. We could integrate with them easily. You could use our VoIP as well, which is on the cloud. But yeah, happy to set up a time with you as well, Douglas. All right, perfect. I think we're good for today. If there are any questions or anything that comes up right after this webinar and that you're able to think of later, feel free to again reach out to me. I read all my emails, so happy to respond, and or just head over to emitrr.com and set up a time, and one of our team members will also be able to help you. All right, thanks everybody, and have a good Wednesday.